We used to live in Michigan, and we had our own home. They shut off our lights to our house, shut off our water, the electric. We tried getting help, and they called CPS on me. My husband just lost his job, so we didn't have an income, and they wanted to take my kids. Got the camper, and then we rented a U-Haul. We packed what we could in that, and we left everything else behind. Who's gonna win?
Me.
The family had a lot of needs, and they basically had nothing. At Winona County, we have 2 workers that are called parent support outreach workers that work very closely with the hub. They do a lot of resource and referral for families. We have specific criteria that the families have to meet with high-risk indicators as far as housing or mental health, substance use, those types of issues, which all fall under the social determinants of health.
So what the hub is a community-based care coordination system, and it's supported by partners in the community. It's not just one individual doing the work. That hub is Live Well Winona being the cog in the middle of all of the other agencies and organizations who are involved in wanting to better our community. We assign a community health worker to a family, and that community health worker does the rest.
We know that 80% of health outcomes are really determined outside of the traditional healthcare system, like a hospital or a clinic. What the Winona Community HUB does is connect individuals to those resources that can help solve those 80% of factors that really impact health.
It could be helping a family find a home, whether it be temporary or permanent. It could also be finding a job. Maybe they don't have a healthcare provider. Maybe their kids aren't enrolled in school. Clothing, food, just about anything that you can imagine.
She got them enrolled in school. They all got backpacks. They got them clothes. They got them everything that they needed. It was just remarkable how much they helped me and the kids.
The one thing that's unique with our hub is we take a whole family approach. Anybody that's in that household is going to be treated as one unit, because chances are if mom or dad are food insecure, the rest of the people in the family are too.
You know, what we really look for in the Trailblazer Award is innovation, and that can occur in many facets. I think the real unique aspect of Winona was the amount of community collaboration that was occurring. This wasn't just a single individual or group that was trying to drive an initiative, but rather the entire system, both public health, private health care, as well as all the nonprofit community partners to band together to improve the health of the entire community.
It's been a good program, and the nice part is it really is pulling together conversations in the Winona area about where we're strong and where we're still lacking. And so it's another opportunity to collaborate in the community that'll make Winona stronger.
I think what we've seen with the Trailblazer Awards is that we can't take a one-size-fits-all approach to healthcare, nor can we do that when it comes to community health. We need to look at the populations within the communities and those populations that have the most need and make sure we're designing innovative solutions to address those needs.
I could never repay them enough. I love all of them like they're my family.
This prevention and early intervention model is where I would love to see our community invest its resources and its time to be able to keep people out of those deeper end services, and it's going to be less expensive, and it's better for our families, and it's better for the kids and less traumatic for our kids within our community.